I recognize Ms. Greene from Georgia.
Thank you, Mr. Chairman, and thank you to the witnesses that are here today. This is an important conversation due to the COVID-19 pandemic response, government lockdowns, forced vaccinations, school closures. Many Americans have lost faith and trust not only in our government, but also in the WHO, and it's extremely serious. The WHO colluded with the Chinese Communist Party. In January of 2020, the WHO repeated Chinese communist propaganda by saying that there was no human-to-human transmission with COVID. The WHO waited several weeks to declare COVID-19 a public health emergency because China insisted they had the situation under control, which was a lie. The WHO did not impose any travel restrictions, unlike President Trump, to help slow the spread of COVID-19 because China did not want their economy to slow down. The WHO continued to praise China's handling of the pandemic despite a globally recognized cover-up. The WHO went along with the CCP's fake claims about the origins of the virus not being from a lab, and our investigations and our own intelligence agencies have told us otherwise. The International Health Regulations, the IHR, is a treaty of the WHO meant to usher in a new era of global public health that requires all member states to cooperate to make the world more secure. The IHR requires only a simple majority to amend it. There have been over 300 amendments proposed, and member states will not be able to see these amendments before they are scheduled to vote. At an October 2023 meeting, the working group compiling the amendments for the 77th World Health Assembly in May 2024 was told that they do not have to produce their document before the meeting. Some of the amendments include expanding the ability of the WHO Director General to declare public health emergencies to include regional declarations as well as intermediate threats, allowing Director General to act on information in the public domain without verification from member states, and creation of a compliance committee to enforce their rules. I can assure you the American people do not want the WHO enforcing any rules on their own personal decisions regarding their health. If certain IHR amendments are adopted next year, sovereign countries, including the United States, would be obligated to adhere to the treaty. The Biden administration led the charge for amendments to the IHR, including a new compliance committee. The treaty would create a conference of the parties which could call on the United Nations for help in implementing the treaty. There is already talk of that conference of the parties being merged together with the IHR. While the Biden administration wants to entangle the U.S. in more globalist organizations and imperil the health and safety of American citizens, President Trump withdrew the U.S. from the WHO completely, wisely anticipating such precarious mandates as the ones being proposed. The move toward a global health security state is reliant upon surveillance, which relies on data. Remember China, that's what they did to their citizens and still do. The treaty and the IHR call for more sharing of personal health data in the name of safety and outbreak prevention. That's an invasion of privacy for the American people. The next step is to create a digital profile of everyone in the world, and if the WHO is giving binding power, the UN will essentially have the power to restrict any American's movement, access to health care, medicine, etc. I can assure you right now the American people will never comply with anything like this from a globalist organization regarding their personal health decisions, and as a matter of fact, any way they decide to conduct their lives. I think this is extremely dangerous. I have a question, Ms. Pace. The working group for the IHR were told recently they did not have to produce their final draft of proposed amendments to the IHR for the 77th World Health Assembly until the event in May 2024. How can the U.S. or any member state have any meaningful way to evaluate and consider the proposed amendments before they are put to a vote?
Thank you very much for the question, Madam Congresswoman. This is a really important issue for us, especially considering our leadership on the international health regulations, not only in this administration, but also going back to the previous administration. And so a couple of things in response. One, I want to be certain and assure everyone here that we echo what the ambassador said earlier about the pandemic agreement. That also applies to the international health regulations and any negotiations or amendments there. We are not going to accept anything that would undermine our national sovereignty. And in fact, the WHO does not have that authority over our U.S. health policies. And so I wanted to be sure and reiterate that. I think that in addition, one of the things that we are hoping, I also wanted to assure you, that the U.S. is very much at the table for these negotiations. And so we do have visibility into the various amendments being proposed and the opportunity or ability to push back, again, as we need to, out of respect for our own sovereignty or other national laws and policy, and that is something we are absolutely doing if and when necessary. Finally, with regards to our own amendments, we did feel it was important to revisit the tiered alert system as we described earlier so that we are not in a position of scrambling in an outbreak, but rather have some intermediate alert whereby we can mobilize resources before we're all in a panic. Also, one of the reasons why we touched on verification of public information is because you had actors like the CCP or PRC not providing that. And so we wanted to provide a sort of alternate pathway, again, to protect America and the world in the event countries weren't being forthcoming.
Thank you, Ms. Pace. I can also assure you in a future Trump administration, given the way the WHO conducted itself, it could be very likely that we withdraw again from the WHO. Thank you, Mr. Chairman. I yield back.